All right, well, welcome back. Now I'm pleased to introduce our esteemed presenters for the session on supporting tribal public health capacity in coronavirus preparedness and response grant assessment results. We are privileged to have the following individuals sharing their expertise and insights. First, we have Ms. Jenkins, the Director of the Division of Jurisdictional Support for the Public Health Infrastructure Center, and Ms. Lamia, Associate Director for Evaluation in the Division of Jurisdictional Support, also for the Public Health Infrastructure Center. Ladies, welcome, and you have the floor.
Okay, great. Thank you, Deputy Principal Chief Warner and Tribal Legislative Barker. I would like to start by saying that I was so grateful to participate in yesterday's meeting virtually. The presentations were excellent, educational, enlightening, and I've participated in TAC meetings before, but I particularly enjoyed the discussions around tribal sovereignty yesterday. I learned a lot, so thank you for that. I'm pleased to be here today to talk about the supporting tribal public health capacity in coronavirus preparedness and response grant, also known as the OT 20-2004 COVID-19 grant for short. Grateful to be able to continue working with you while respecting tribal sovereignty to leverage the capacity, expertise, and resources to achieve the greatest impact on health issues affecting American Indians and Alaska Natives. This remained at the forefront of our minds in the implementation of this particular grant. What you will hear and see in this presentation is that COVID-19 Tribal Capacity Grant aided tribes, tribal organizations, and tribal consortia in their ability to deliver critical programs and foundational public health services in response to the pandemic, while building public health infrastructure in Indian country. Let's go to the next slide, please. During this presentation, I will provide a brief background on the grant, and my colleague, Tamara, the Associate Director for Evaluation in DJS, Division of Jurisdictional Support, Tamara Lamia, will present the grant assessment results overall and take a closer look at the results that support the building of tribal public health infrastructure and capacity. These results are based on review of closeout reports submitted by the grant recipients. Next slide, please. We will take about 25 minutes to present the findings and have approximately 30 minutes for discussions and questions. Next slide. So to set the stage, I'm going to go through again a brief background of the grant, including its scope, size, and strategies. Next slide. Oh, go back one more. Sorry. Thanks, Tamara. So many of you know this, but as a reminder, this was a one-year grant that was awarded in spring, summer of 2020. The grant provided approximately $153 million in federal emergency funding to a total of 346 tribal recipients. These included tribal nations, tribal organizations, and tribal consortia. Through these entities, the grant reached 495 tribes. It was a non-competitive grant that the recipients used funds for a wide range of COVID-19 emergency response needs across 8 strategy areas. The grant recipients were allowed to be reimbursed for COVID-related costs that were incurred prior to and during the pandemic. For the alteration and renovation of non-federally owned facilities, which was something that was novel to typical CDC grant programs. And we also recognize that there was a lot of COVID funding available during this time. Therefore, we were able to offer no-cost extensions to allow recipients additional time to use the funds. So over 300 of the grant recipients did receive no-cost extensions up to June of 2023. Now we can go to the next slide. The grant supported public health activities across a set of strategies. And Tamara is going to go into specific examples of activities related to each of these strategies. But as a reminder, they were emergency operations and coordination, health information technology, laboratory capacity, communications, countermeasures and mitigation, recovery activities, and other preparedness and response activities. And so for the purpose of this assessment, all of the activities that we looked at in that 8th area were aligned to the 7 aforementioned strategies as they best fit each area. So I will turn it over to Tamara to get into the details.
Thank you, Stacey. Good morning, committee members. Thanks for the opportunity to present today. As Stacey mentioned, I am Tamara Lamia. I'm the Associate Director for Evaluation in the Division of Jurisdictional Support, and I am very, very happy to be able to present these findings to you all today. I think it's a great segue from this morning's conversations as well, and I look forward to your reactions and discussion. So there were 2 key purposes, and you can go to the next slide, please. There are 2 key purposes for the assessment. First, the assessment is meant to demonstrate the results of CDC's investments in COVID-19 preparedness and response in tribal communities. And second, it's intended to build evidence to see what works to improve public health capacity in Indian country. Next slide. So in addition to these purposes, the project was guided by a set of key questions, which included how did the COVID-19 Tribal Capacity Grant support recipients in addressing the community's COVID-19 response needs? And then how did the grant also support recipients in building basic public health infrastructure and foundational capabilities in Indian country? Next slide, please. So before moving into the summary, we'd like to share a bit more information about the approach taken and the type of data that were included. The assessment reflects activities submitted in 272 recipient final performance reports, and this is of the 346 awarded, as Stacey mentioned, and this represents almost 80% of the funded recipients' work. So final performance reports or closeout reports that were submitted by September 30th of 2023 were included in these analyses. So this timeframe represents achievements from the start of the grant, which again was around summer of 2020 through the summer of 2023. So among the 272 recipients submitting reports included in the assessment, 223 were tribal nations, 27 tribal organizations, and 22 were tribal consortia. And the analyses includes reports from recipients from all 12 Indian Health Service areas. And I did want to note that as we reviewed and summarized the data, we did look to see if there were any notable patterns or trends by these recipient types. And in general, we did not see any major differences. So when you see the results reported out in the following slides, these represent nations, the organizations, and the consortia. So next slide. So our approach to the assessment included the following. We had a team of 10 staff members with public health and evaluation experience working on the project. And they started by doing a close read of each individual final performance report, which is submitted in the form of a spreadsheet, to understand what activities were completed and review the descriptions of what was accomplished. The data then was tagged, so all the results, achievements, deliverables, and so on allowed us then to group and tally common types of results being reported. And then we summarized that in aggregate to get an overall picture of the grant accomplishments. Next slide, please. So I'd like to emphasize a few contextual points and considerations related to the assessment. So first, the grant was designed to be a uniquely flexible funding mechanism with more allowable expenses that is typical for a federal grant. Secondly, the reporting process was intended to be low burden in nature to minimize extra work. So the project was, we approached this project then with these 2 priorities in mind. And so the methodology accounted for and included a large range of activities that recipients were using funds for, and the work utilized reports that were already part of the regular biannual report submission process. So although the starting point for the work is individual recipient reports, the overall analyses and summary focuses on aggregate results, so those across the whole grant. And finally, it's important to highlight that the summary is quantitative in nature, so it really does highlight the numbers, less so the stories. And we recognize there are more layers of meaning and narrative that are not captured in what we are showing today, and that is a limitation. Next slide, please. So moving into our findings, I'm going to share a summary of grant areas of focus and a few accomplishments. So next slide. So as shared earlier, the grant included different strategies in various areas of emergency preparedness and response, and these are listed on the left-hand side of this bar chart. So recipients could choose to focus their work on any number of these strategies. So some recipients focus their work maybe in just one or two, and others spread their work across a greater number. So this graph shows that it was most common for recipients to report results that fit within the countermeasures and mitigation strategy. And this strategy encompasses a lot of different types of work related to responding to and mitigating the impact of COVID-19 in communities. Other popular strategies are communications, emergency ops and coordination, and laboratory capacity. So note here that the total number is 271. And for those that were closely listening and seeing the other ones, this is one less. And this is because one of the final reports included was not in these analyses as their report results did not align with how the coding protocol was set up. So also I want to note that recipients again could work across multiple strategies. So as you look at these totals for each strategy, they're not going to equal the total number of recipient reports. Okay. So next slide, please. So beyond looking at results by each grant strategy, we explored the data in many ways and identified several cross-cutting trends that I will briefly highlight here, a few of which I'm going to go into greater detail in the following slides. So the top area of accomplishment that we saw is in procurement of supplies, equipment, and other infrastructure-related products and assistance for the COVID-19 response. So we saw 98% of recipients reporting some sort of result in this area. 74% of recipients reported having developed or implemented some type of programs or services related to COVID-19. 67% reported having conducted some sort of data analyses or assessment work to support the COVID-19 response, and 64% hired or filled staff positions and or provided or received technical assistance. So next slide, please. So diving deeper into the results, we sought to understand in what ways this grant may be supporting broader public health infrastructure and foundational capabilities in Indian country. So next slide, please. So to understand the results from the grant, we are using a framework known as the Foundational Public Health Services Framework. So what you see here on the screen, and it outlines the unique responsibilities of governmental public health and can be used to explain the vital role of public health in a thriving community. The bottom part of the graphic shows the foundational capabilities. These are focused on key infrastructure capabilities and services that are seen as important for public health departments to have in order to fulfill their mission and serve their entire community. Note here that equity is not only a capability, but also is the underpinning for the entire framework. Next slide. Oh, nope, sorry. Please go back. Thank you. I want to go in a little bit detail on all of the areas and foundational capabilities. So the top part of the graphic describes the public health foundational areas, and these are more programmatic areas of work. So these are critical to public health department functions, including everything from communicable disease control to access and linkage with clinical care. The foundational areas reflect the minimum level of services that should be available in all communities. So to understand how the grant may have supported broader public health infrastructure and foundational capabilities in Indian country, we manually crosswalked this framework with our COVID-19 Tribal Capacity Grant Codebook to analyze the recipient closeout reports. So when appropriate, the codebook was overlaid with the framework, allowing for closer analysis. We then aggregated and visualized the data, which then could point us to how the COVID-19 Tribal Capacity Grant work may be supporting various foundational capabilities and program areas. We saw that grant accomplishments have spanned the areas and capabilities, with some activities more focused on direct delivery of programs and services in response to the pandemic, while others are more related to building or supporting key infrastructure capabilities. So we're going to go ahead and review now the results for each of the capabilities and area present in the data. So now please, next slide. Okay, so we'll start with the foundational capabilities. So that's what was at the bottom of that graphic you just saw. And there are 8 foundational capabilities that are needed in public health infrastructure. And again, these are those cross-cutting skills and capacities needed to support basic public health protections, programs, and activities. And so recipients reported deliverables that aligned with 5, and those are the ones that are circled here on the screen of those 8 foundational capabilities. Of the 5 capabilities represented, recipients most frequently reported results aligned with the organizational competencies. So we'll look at each of these in closer detail. Next slide, please. So as mentioned, the recipients most frequently reported results with the organizational competencies, and what's included in this are financial management, contract and procurement services, including facilities and operations, information technology services, and workforce development and human resources. So 219 recipients reported results in this capability area. So again, a reminder as we go through and look at these for all of the data, the recipients are tribes, tribal consortia, and tribal organizations, and they could work in multiple areas and complete a variety of activities within and across strategies. So again, this data that you're going to see within each of these top 5 will add up to more than the total number of recipients reporting a result in these capabilities and areas. So digging into the organizational competencies, we can see that they fell into the areas of information technology services and workforce development. So those results aligned with the IT services included communication IT infrastructure supplies or services procured. And examples of these are things like video conferencing, laptops, phones, radios. Health IT infrastructure supplies or services procured. Some examples of these are things like telehealth online portals, remote patient monitoring devices, mobile telemedicine units. And then also internet connectivity was established or expanded. So this includes having stable broadband connection, Wi-Fi, and mobile coverage. So the results aligned with workforce development included hiring or filling staff positions for mostly countermeasures and mitigation and emergency op and coordination roles. And these were with a wide variety of titles and roles within the communities. Next slide, please. So 201 recipients reported results in the assessment and surveillance foundational capability. And the top 2 results in this capability were conducting testing and processing test specimens for COVID-19. So recipients also reported collecting, analyzing, and reporting on surveillance and epi data, which includes developing models to anticipate disease progression, analyzing patterns and trends, and reporting out of these findings to leaders and others. They also did screening and tracking for surveillance purposes. So this includes screening employees or clients coming in and out of workplace settings, as well as travelers entering or leaving jurisdictions. They also procured and installed physical infrastructure or large equipment for lab capacity. So this would be a construction or renovation of an existing space into a lab facility, establishing a testing site, or procurement of a mobile unit to conduct COVID-19 testing. Next slide, please. So 166 recipients reported results in the communications foundational capability. So the most reported activity under communications was conducting outreach and disseminating educational materials and messages to increase community knowledge and awareness of COVID-19. These materials included flyers, presentations, videos, and public service announcements. So other activities under this area included deploying communication and media channels. So this would be setting up websites, social media pages, putting in place email listservs, text messaging, tailoring and disseminating communications for specific audiences, and developing plans for communications, as well as then developing trainings and resources for communications. Next slide. So 157 recipients reported results in the emergency preparedness and response foundational capability. And this included a wide range of activities focused on COVID-19 emergency ops and coordination. So they developed plans, they established incidents management structures, implemented programs and protocols to support the health and safety of the public health workforce, also developed plans for recovery, and procured and installed physical infrastructure or large equipment for emergency ops and coordination. And some examples of this may be trailers, generators, construction or renovation of a temporary or permanent facility. Next slide, please. So the last finding for the foundational capabilities represents results for community partnership development, and 137 recipients reported results that align to this capability. And as you can see on the slide, recipients reported informally collaborating across many of the grant strategies. So mitigation, emergency ops coordination, for communications, for surveillance and epi, and for lab capacity and testing purposes. So now we're going to turn to the foundational areas within the framework. So next slide. All right, so there are 5 foundational areas or public health programs in the framework, and these are the public health sort of topic-specific programs and services aimed at improving the health of communities. And the foundational areas reflect the minimum level of service that should be available in all communities. So the 2 areas where recipients reported results, communicable disease control, as well as access and linkage with clinical care, show us, really not surprisingly, that the grant funding has gone to support improvement for a wide range of mitigation, surveillance, and preparedness and response programs. Next slide. So looking at these 2 in closer detail, 257 recipients reported results in the Communicable Disease Control foundational area. And this includes, again, a wide range of activities. In this visual, we've listed the top 5 types of results in this area, with procurement of supplies, equipment, and infrastructure-related products or assistance was the top area. So most of these had to do with acquiring concrete goods, but in some cases also included procurement of services and activities. So for this, we see that procuring PPE or personal protective equipment such as gloves, face shields, goggles, gowns was the top result, as well as in procuring cleaning and disinfecting supplies. This includes hand sanitizer, procuring or installing large equipment or infrastructure for countermeasures or mitigation. So this would be converting a building to serve as a COVID-19 vaccination site, or structural improvements to build ventilation and air circulation. Procuring office and field operation supplies for countermeasures and mitigation included items to reduce COVID-19 transmission, such as plexiglass barriers, automatic faucets, and motion sensors or hand-free doors. And then supporting the COVID-19 vaccines as well. So these are activities to support the distribution and delivery of COVID-19 vaccines. And note here, though, that this does not include payment for vaccines nor clinical care, as those were not allowable expenses for this grant. So next slide, please. So 127 recipients reported results in the access to and linkage with clinical care foundational area. And this area includes activities focusing on coordinating healthcare services with a focus on COVID-19 treatment. So under this area, recipients reported a wide variety of activities, again, with the top result being coordinating telehealth services. They also procured non-COVID-19 healthcare supplies, and that example includes equipment to improve the safety of dental or oral health services, as well as surgical supplies and apparel. Also procuring COVID-19 diagnostic and treatment supplies for healthcare or clinical settings. So these are things like ventilators, oxygen supplies, supporting or facilitating access to COVID-19 healthcare services. So these are things that took place to support the prevention, management, and treatment. So looking at mobile medical units, and then supporting or facilitating access to non-COVID-19 healthcare services. So things that would help to maintain the continuity of care for the community during the pandemic. So supporting dental care or eye care, for example. So overall, as I walked through all of that with all of those numbers, we really do see that the COVID-19 Tribal Capacity Grant has made a concrete difference in delivering programs and services in response to the pandemic, as well as looking at building that public health infrastructure in Indian country, as we see with the alignment with the Foundational Public Health Services Framework. So next slide, please. So I'd like again to thank you for your time today, and I'm going to turn it back to Deputy Principal Chief Warner and Tribal Legislator Barker for any discussions or questions you have, and we do have some for consideration on the slide as well. So thank you very much.
All right, well, thank you both. Great presentation, very appreciative. So now I want to open up the floor to our TAC delegation for further questions regarding the assessment. Just a reminder online, please use the raise hand function, and we will open up the floor to our TAC delegation for any questions. Anybody online? I might have a couple. Just, oh, never mind. Ms. Russell, go ahead. Yep.
So thank you for the report out on the assessment. I'm glad that you did do this assessment. So what did, of course, you kind of shared with us what you learned from it, but being that you learned from it, what sorts of things can you do moving forward in this space to continue some of this? I'd like to hear maybe your thoughts on that.
Well, yeah, I can certainly start. And one thing I did want to remind people about this grant, in my mind, I'm proud to say that I was able to work on this grant from writing the NOFO to seeing it through. And so it was such an honor for CDC to fund this many tribes ever directly. So I do think that we made some progress in that area. And so that kind of feeds into that question. I think that this can be done, us working together. I was taking notes and listening to the discussion earlier, and I see that there are two primary areas that we could work on collectively. One is around the eligibility expansion for our grants and cooperative agreements, and then also the direct funding line. And so that's something that I'd like to continue having discussions with all of you around, like how we do that, from our different respective roles. So we do know that this can be done. So those are, I'm open to suggestions and ideas on how we can continue to get funding opportunities just like this one. Because I think this is one of the good things that did come out of COVID. We were able to provide funding, broader funding at a much faster rate. It usually takes us a year to write a grant or a cooperative agreement. We did this one in like less than 3 months. So there are things that can be done when we're put in situations or facing public health emergencies, and we all work together. So I'll stop there just to see if anyone else wants.
Yes, Dr. Dolphin.
I'd just like to add that just for those who may not be aware, Stacey and Tamara represent the division in our center where the tribal cooperative agreement sits, as well as the COVID supplemental tribal coax set. So in terms of taking the recommendations that we're hearing here today, I think it would be great. I'm putting one of our directors on the spot for Stacey and her team to join our TAC meeting so we can come up with concrete actions that we can move forward. So I'm inviting Stacey to attend an upcoming TAC meeting where we're talking about tactical things that we can do to address the recommendations that we hear today. And I know she'd be delighted to do that.
It would be my honor. And I will be remiss if I didn't introduce two other faces I would like for you all to get to know. And that's Teresa Dobb. She's in the back, and Ms. Sonal Doshi, if you guys can stand up. Teresa is the branch chief, and they manage the Preventive Health Services Block Grant that you all may be familiar with, and also the umbrella cooperative agreement that Dr. Dolphin gave an update on. And Sonal is the deputy branch chief. So we all work collectively as a team on all three of these funding vehicles. We also manage the public health infrastructure grant. I'm sure you all are aware of that. So there's lots of opportunities for us to continue to collaborate.
Thank you, Chief. So you do have infrastructure. So continue, and I just implore you to continue to build upon that infrastructure, and let's not wait for another emergency like COVID to happen for us to be forced to do this. So you all are at a different point in the race. So just please continue to take what you have and build upon it. Thank you.
Yes, Second Chief Dale Beaver.
Thank you for the presentation and thank you for the assessment. I always like assessments to see how well we're doing. And so it's and really, I think of all the bad things that the coronavirus did to our communities, there was also some good things that, I don't want to say it did to our communities, but it did. There's some good things that it showcased that the tribes can do for our communities. And so when we talk about response, hands down, the tribes responded quickly, and we responded with a lot of information from the CDC. And I think this really showcases how well the tribes are in tune with the communities that we serve. And so, and with this, the grant money that we received, I think it was around maybe like 1.4 million, somewhere around there. We're able to buy, tents, hospital beds, a text alert system, those types of things. And so we appreciate that. And so I heard it just a minute ago that this has really set the foundation for what tribes can do. And so I do appreciate what the CDC has done. And I think that we need to start looking at this as more of a as a true government to government agreement. We are sovereign nations. We take care of the people within our reservations, within our boundaries. And it really doesn't matter to us if you're a citizen or not. When it comes to emergencies, we don't politicize things, whereas maybe the state does. And so if you need help, we tend to help you. We don't care if you're Democrat, Republican, Independent, doesn't matter to us. So I think that those things and the way our perspective is this goes to show that whenever programs, infrastructure is funded in Indian country, it really does get to the people that need it the most. And it's not locked up in bureaucracy. It's not mismanaged. We run tight budgets, and I dare to say we run a better budget than the state that we're in right now. And so we have we are well ran, and especially in our health systems. And so I do appreciate that. Really, what this did, it showcased not just my nation but all nations of what we can do. And so, like I said, I heard it before. This is just a stepping stone. This is the foundational block of what we can do as tribes. Even on the FEMA side, our chief has issued a lot of state of emergencies within our reservation, whereas the state might not. And so last year, FEMA, we issued a state of emergency within our reservation. FEMA gave us money, and we were able to, and there was actually some municipalities able to get money from us because the state didn't and the state wouldn't. And so we were able to act as that governmental entity, whereas a local municipality that needed that help, we were able to help them. And so, whenever, we don't ask the state for anything. And we don't want to ask the state for anything, and we shouldn't have to ask the state for anything. We are a sovereign nation, and so that's the way we see it, and that's the way it's going to be. Is that we wholeheartedly feel it's a government to government relationship, and so we appreciate that.
Thank you.
Thank you, Second Chief. Anyone else? Well, I'll take it. Oh, go ahead, Ms. Frias.
Well, thank you for your presentation, and thank you for presenting this data. I really do appreciate it. And I know that you mentioned that, this is all the empirical data, but it doesn't include the stories. So I don't know if there will be an opportunity to share those stories, because those stories are really important. And I think that having the opportunity to go back and talk about those stories and share those stories are important. So I think that that we should do that. The other thing that I wanted to mention is that with the, I agree with Dr. Doffin's inviting you to come to the next TAC and really have a discussion about how do we get this funding flowing, because one of the things that has come up is, with the grants and the grants and also cooperative agreements, it's kind of been used interchangeably, and they're very different.
Yeah.
They're very different. Mm-hmm. And when it comes to actually administering these funds, they're very different.
Yes.
So we want to make sure that what it is that we're doing, whether it's a grant, it's a cooperative agreement, or that the opportunity is there that we can create direct funding, we are creating those opportunities. So just want to make that statement. Thank you.
Yeah, I totally agree with you about that. And one of the reasons we we chose the grant mechanism versus cooperative agreement for this because there's more flexibilities with grants. But I wholeheartedly agree with you on figuring out a way that we can let this set the stage for future funding that's broader. Because like I said, I was grateful to see that we were able to do it, so I know that it can be done. But we definitely need additional funding to really make an impact.
Ms. Sanchez?
Yes, thank you for this presentation. I just have a comment that it's very refreshing to see a non-competitive grant go out to so many tribes and work so well. It's always my frustration that they're always competitive. And this just proves how well they work when they're non-competitive and the money is there. It's very refreshing to see these results. So thank you.
Thank you.
Anyone else? Legislator Barker, anything? Okay. Well, yes, go ahead, Ms. Russell.
Thank you, Chief. So your work with tribes is unique. You know, I think this is a blueprint across not only CDC, but, you know, other departments within DHHS, other agencies. Can you maybe speak to some of the conversations you had with tribes since you were able to work with so many outside of what you could fund? And what were they? And I'm trying to get more at the social indicators of health. And maybe what is that conversation you're having here internally and working with other agencies within DHHS and even outside of DHHS? And so just to kind of try to have you where I'm in this space. So our issue with our tribe is housing. Right, when we were going through COVID, where the message was isolate. It was very, very difficult to isolate our members because we lived in multi-generational homes. It's not unheard of to have 15 members or more in a one-bedroom home. That's not unheard of for my nation. And so we wanted them to isolate. It was very difficult. My mom caught COVID. It was very difficult for us to do that. We had all of our kids had to take time off of work. It was very difficult, but we were able to do it because we had stable jobs. But that's not the issue. That's not the norm for most of the people from my nation. But access to safe housing was a huge issue. And then also just wanted to speak to food insecurity on my nation. I think that's probably the one thing that I address almost every week is food insecurity on my nation. And so I'm just curious about, you know, the work that you did with tribes. What were some of the things that you could not fund that was being requested? And I'm going to assume it's outside of your scope. And what conversations are you having with like HUD or with USDA or these other departments around that?
Great questions. Thank you. And for this particular grant, I do remember we worked directly with IHS and the Bureau of Indian Affairs. But you know, we were rushing to get the funding out, so we didn't have, you know, broader conversations with HUD and others. Like that's something that we definitely need to do a better job at doing. But for this particular grant, some of the things that we tried to build in that aren't in typical grants were, you know, as I mentioned, the being able to use the funds for renovations or you know, construction, like we typically don't do that. So that was one of the things we tried to build in. Also put in a mechanism where the recipients could get reimbursed for any costs that they incurred prior to getting the grant that were related to COVID, of course, and during that time. So that also included like dealing with some of the food insecurity issues. You know, a lot of our grants, you can't buy food per se, but this one you could buy food, you know, you could reimburse people. I think that there was one of the recipients that had police officers and almost everyone in their community helping provide public health services. So they were able to pay for some of those salaries just to kind of help. And so the point that you made about telling the stories, getting into the granular details about some of those stories is something that we're working on. And so we'd love to hear ideas from you on how we can share that, you know, out beyond our attack and beyond with the recipient so others can learn from that. So that kind of speaks to some of it, but as we move forward, I do think working across government can kind of help leverage all of the different parts, because since we're so siloed, but all of us fundamentally have the same shared interest in improving the health of people across our country. So we do need to do a better job of working across the different government agencies as well. So I hope that may not be a satisfactory answer, but it's what happened.
Great. Thank you. Well, sorry, Ms. Danforth.
Again, just echoing what everyone else has said is thank you for the presentation. And I'm just going to share one of the stories because we were a recipient. My tribe was a recipient of this grant. And one of the stories that I think is important is that, with the funds that were issued to us as part of this grant, we were able to set up remote work for all of our behavioral health program, all of our medical offices, our dental office and our optical office within a span of 2 weeks' time, because we were able to purchase the equipment and our IT department worked day and night to get those remote working for all of the staff that needed to do that. So I just wanted to share that. And the other thing I wanted to share is that with some of the funds, we were able to utilize that with some other funding that we had to purchase a large generator that would facilitate our whole health facility. My staff weren't real happy because now the generator keeps them working for 8 hours instead of letting them go home after the first 45. So I just wanted to share that with you. So thank you.
Oh, congratulations. That's awesome.
That's a great consequence to have, though,
Right.
Yes, it is. I didn't, that's not on the record, is that? Yeah. No, thank you all. Great conversation. Some stuff that was brought up in some of our talkers earlier, and I heard something about federal reimbursement. Perhaps, when we're starting to think about strategy, maybe a guidance document. And I know it's pertaining just to this grant, but maybe if there's other areas where there's federal reimbursement, how do we guide a tribe or an entity through that process that could become cumbersome at times? Proper preparation prevents poor performance, right? So strategy, all of these opportunities, health IT strategy, emergency operations center. Yesterday, we got to see what the CDC had. Not all of us need anything that big, although it would be cool, but Dr. Gann from Cherokee Nation was with us and he's like, well, this would be something great to have. And I know a lot of other tribes looking at that, but I think on a lot of this, when you look at assessment, what type of strategies can we develop out of this to help to mitigate any circumstances with stumbling blocks early on when the anxiety is the highest, because our ultimate job of these things is to lower that anxiety so that learning and capacity goes up. They're both inversely proportional to one another. So great. And thank you, Ms. Danforth, for sharing those met needs, those met goals. That's the thing that resonates, those stories and everything. So both of you, great job. Very appreciative of the presentation. Let's give them a round of applause, please. All right. Well, that takes us to a good time here. Looks like we're going to have a little bit of extra time for a networking lunch. Before we break, though, I want to ask Captain Killsback if he has any information or anything he would like to add to the group. I know I'm throwing this right at you. Yeah.
Oh, I think we have the same setup for lunch today as we did yesterday. But I do want to echo Deputy Principal Chief's comments about the discussion we had earlier. And I want to thank Stacey and her team for the work they've done. Very impactful work across Indian country. But there's a lot of good things that came out of COVID. It was a very generational, I think, pandemic that impacts a lot of folks. And it really shouldn't take a pandemic for us to be able to help one another. And to Principal Warner, Principal Chief Warner's point about that. All our tribal communities, we're not just comprised of tribal members. We have people from different tribal nations represented on our homelands and also non-natives as well. So they also they benefit when we support our tribes and we work together with our federal agencies. So that's the spirit of cooperation. We have one common goal. We're all U.S. citizens as well, not just the citizens of our individual tribes. So thank you for those comments earlier, Deputy Principal Chief.
Yeah, thank you. Dr. Dolphin, any comments before we break?
Well, I just think this was a really great discussion, the budget discussion leading very nicely into the assessment of the grant program. So thank you for your comments. We are noting everything. So in addition to recording the meeting, we also have note takers, and we are committed to following up on the recommendations and the outcomes from this meeting. So this engagement means a lot to us. We take it very seriously and we appreciate it. A very good first start of the second day. So
You bet.
thank you, Deputy Principal Chief and Legislator Barker. I'm not going to take any more time because it's lunchtime and it's good to have more time for lunch. So
Okay.
I'll turn it back
All right.
over to you to let us.
Thank you both. And also too, just a reminder, we have lunch outside. This is the point where when we come back from lunch, the meeting is going to get a whole lot better. Okay, because Legislator Barker is going to be in the lead. You know, we're taking off on a plane, but in Cherokee Nation, we say Gagayui, I love you. That goes out to each and every one of you. Thank you for your time, your talent, your dedication to your tribal nation and to this TAC. We're elevating this TAC each and every day, each and every second. And also, Agiosi, I'm hungry, so let's go eat.